All right, good afternoon, everyone. We're still waiting for a couple of more attendees to start rolling in here, but we see that there's many coming in. We've got Brandis, Christy, Louise, Marcy, Pam, Sierra, Wanda. So we're going to take a couple of minutes here just to let people join. It's just 12:03. Michelle, welcome. My name is Ule. I'm going to be your moderator for the day, and we're looking forward to the chat. I'm going to be taking a couple of more minutes here, and Marcy, welcome. Louise, welcome. Kent. Bev, Barbara, oh, this is great. We're getting well over a dozen, starting to push closer to 20 people joining us. I'm going to start off first to say welcome to everyone, and just to introduce the topic today. We have a couple of speakers, Karen Smith and Zara Badia, and the topic is mostly on funding opportunities and how it is that community members can access that funding. And we're looking forward to going through a lot of good information and answering your questions about how it is that you as community members can access funding and how we can help you. So first, I'll ask Alicia to pull up a share screen here for me. So the first thing I'd like to do is just introduce not just our two wonderful speakers, Karen and Zara, but also some of the other folks that have been working in the background that are absolutely crucial to helping getting webinars like this up and running. So there's a whole team of people in the background. So first I'd like to introduce our first speaker, Karen Smith. Karen's been a social worker at the Glenrose for just over a year. She assists patients on a spinal cord neurology unit, and she primarily works to help these members access resources, prepare them for their discharge. She's worked as a research assistant for many years with the Rick Hansen Institute, and she also worked for many years in Spinal Cord Injury Alberta. So this was prior to 2015, and she was with the Spinal Cord Injury Alberta for 13 years. So she's a very knowledgeable person on all aspects of community transitions in care and funding, and we're very glad to have you with us to provide some information. Our second speaker is Zara Badia, and she's a manager for Alberta South with Spinal Cord Injury Alberta. Zara is also trained as a social worker, and she has been with SCI Alberta for almost a little over 10 years now. So she's worked in a number of our programs, and as a leader in the Alberta South region, she's especially involved with the Foothills Medical Center. Next, a person that's been working very much in the background with us to pull all of the information together is Taryn Buck. Taryn is a rehabilitation navigator at the Glenrose, and she started at the Glenrose on the Spinal Cord Injury and General Neurology Inpatient Unit in 2006 as an LPN, and then she worked full-time. She completed her bachelor's in nursing, and she started working in the unit in 2014. Next, we have Steve Crochetier, and Steve is our peer coordinator with SCI Alberta, and he works all across the province, pulling in community engagement, doing virtual work when we can, when we don't have COVID, doing a lot of in-person work. Steve also works and distributes medical supply equipment with the community, especially the Myelin FES cycle through his Euro medical supply company. Alicia Velji is a team lead in Calgary. Alicia works a lot with our social media team. She's been around for also about 10 years with SCI Alberta and works across, I think, almost all of our programs one way or the other, and is a great assistance to our social media team. And last, and by no stretch of the imagination, anywhere least, Guy Coulomb. Guy has been with SCI Alberta for 35 years. He has had a spinal cord injury for as long as I have been alive, and has a tremendous amount of knowledge. Guy has worked in every program that we have in Spinal Cord Injury Alberta, and over the 35 years, he's held many roles. Currently, he's away on medical leave, but we're looking forward to having Guy back, hopefully towards the end of the summer, continuing to help with our information systems and databases. So this is the team that really works on the background. Just wanted to make sure that I mention them, give all sorts of respect and kudos, because they really are the ones pulling this information together. And on that, I wanted to give an update that Karen's going to go through a lot of funding programs. The format that we're going to have is Karen's going to take a bit of a break after each of the programs, and we're going to invite questions. And really the questions that that I expect you all to have, please go, there's a Q&A box in the bottom of your screen. And when you have questions about funding programs, please put your questions in there. I'm going to be looking for your responses in there. So is Steve, so is Alicia, and we're going to be seeing if we answer them directly for you or if we direct them to be answered live by Karen. The other thing to keep in mind is that as we go through this, if there's anything that you have for ideas or any sort of suggestions, please let us know. We're always looking at the chat box. And there's also going to be a poll that comes up for everyone to participate in to kind of give an aspect of how do you find these webinars working for you and when would you like to hold them. We're always looking for feedback from the community about the best way to deliver content like this for you. So really today's format is going to be a lot of information about funding, a lot of new information that's out about funding components, federal and provincial, and really also how SCI Alberta works with organizations like the Foothills Medical Center, with the Glenrose Rehabilitation Hospital, and how we work in the community to help transitions in care and also help community members in outpatients. So Zara is going to be speaking a little bit more about that in detail after Karen goes through a lot of different funding programs. So on that, I will step out of the way and allow Karen to take over the screen now. The floor is all yours, Karen.
All right, well, hello everyone. Thanks a lot to SCI Alberta for inviting me to participate today. I've been here at the Glenrose Hospital now just over a year, and I know even just with my experience in the past working with SCI Alberta, that we really appreciate the relationship that we have with Spinal Cord Injury Alberta, because a lot of times when we discharge patients, we can't continue the same types of services and assistance that we provide here. So SCI Alberta can help out a lot with that, and we kind of transition to them assisting people back home and in the community. So that's really helpful for us to know that there's some consistency with patients to receive services. I also just want to know that I, by all means, I'm not an expert. I don't consider myself an expert. I've really learned just from years of working with patients and people who have mobility issues and spinal cord injuries about how they've accessed services, the challenges that they've had, and kind of ways that they've overcome them. So I've been a social worker for a long time. I've been a social worker for 22 years, and I've worked with people who have spinal cord injuries and mobility issues for probably the last 15 years. So, you know, I've kind of learned just basically from the people that I've worked with and collaborating with other agencies as well. So I guess I'm going to try to bring up my screen here, my PowerPoint, and is that working for everybody?
No, I don't think that's sharing yet, Karen.
No, it's not. Okay, let's see. So I just had. Having a little technical difficulties over here.
If you like, Karen, I think that either Alicia or I can share the screen for you and go through that.
Here, I can, yeah, maybe that would be best. Here, I'm going to just forward it to you guys really quick because I did make a couple changes. Yeah, it seems like my internet connection's a little bit slow today, so. So the first program, anyways, I can kind of start talking about it before we bring it up here. Is of course, we're going to start with the big one, AISH, Assured Income for the Severely Handicapped. I'm hoping that Lily can bring this up now.
I'm going to bring up, because I haven't received your email yet, Karen, but I'm going to bring up the one that you sent, which hopefully will be almost entirely up.
Okay, sure. There we go. That would be helpful. Didn't work out for me, but. So yeah, so I'm going to talk a little bit about AISH to start off with. Some of the information that's going to be on the slide is just in terms of eligibility. So to be eligible for AISH, it is a lower income program. You have to meet the basic medical and financial guidelines. And basic is really just being an adult over the age of 18, being a Canadian citizen or permanent resident, as well as a resident of Alberta. The financial guidelines, I really do want you to refer to the AISH guideline booklet, because there's a lot of intricacies with your income and assets. One thing to remember is that I think it's up to $100,000 that is non-exempt or exempt, sorry, from your to look at your eligibility. So, which is really good. So, and they also allow you to have like a primary vehicle, a primary home. You are able to work part-time. Some of the people oftentimes think that it's either you work or you don't, and that's not necessarily the fact. So the standard living allowance is $1,685 per month, and that's just kind of the basic living allowance. So you might, in addition, receive health benefits, personal benefits. You might receive benefits for your kids, anything like that. The health benefits usually include extended health benefits like prescription coverage, dental coverage, etc. And the personal benefits, they kind of cover what you can't get covered elsewhere. For instance, like a hospital bed or maybe a wheelchair rental. You just need a letter of support from a medical professional, an occupational therapist or PT or physician to support your ask for that. And then you would send it into your case manager. With AISH, it is income-based, so any income that you have coming in from a different source, you have to report to them and they'll subtract it from your monthly benefit. So usually they'll make you apply for Canada Pension Plan Disability, which we'll talk about in a minute. If you do qualify and receive that benefit, you'll have that subtracted from your AISH allowance. So you will always usually get about $1,685 or just a little bit over, depending on your benefits. So there's 3 levels of appeal. There's a reconsideration of denial, which is really just sending additional information to the case manager person that looked at your initial information to see if there's anything additionally that you can add that might change their mind. So the important thing with appeals is to make sure to review your letter of denial very carefully to find out exactly what the reason is you were denied. If it was financial, if it was medical, if somewhere in the medical report your doctor or physician had indicated that you'd be able to return back to work in 6 months, then you wouldn't qualify for AISH. The main way to look at it, or I guess the main way to figure out if you qualify, is do you have an injury or a disability, a permanent one, that prevents you from working full-time or making a living allowance that sustains your living, and you would need the medical support to back that up, as well as make sure that all your financial stuff kind of figures into that. So that's, yeah. And in terms of the second part of the appeal is the appeal secretariat. It goes up to another level. They look at all the information again by somebody different. So it's kind of a different set of eyes and, just to look at the information. And then the third part is the appeal board. And the appeal board is generally made up of community members, people that have applied. They're not typical case managers of AISH or anything like that. They're people like you and me that have made up the appeal board. Sometimes I've often seen like retired school teachers or people in the community who've made up the appeal board. So it's kind of nice that you will often come into it, knowing that there are people that are very similar to sometimes your situation, who can understand it from a different set of, they're coming from a different place, I guess. So that's really important too. Just looking over my notes here. You are allowed, and you can keep up to $1,072 above your AISH benefit when you work. After that, they'll subtract 50% of up to $2,009, and then to a maximum exemption of $1,541. So what would happen is after you're receiving your $1,541, you'd still get your full benefit. You would also still continue to receive your health benefits, as well as your other additional benefits, your personal benefits. So, so the next, we can go on to the next slide, or I guess if there's questions, we can go to questions. There's a couple other quick things I wanted to mention too. When you're applying for AISH, it's important for you to have a conversation with your physician or your specialist to find out if they actually feel that you qualify, that your injury is permanent and severe enough that it will prevent you from working full-time. Oftentimes, people will just have their doctor complete it. It'll go in, and specifically there are things on the medical report that is why you've been denied. So having that conversation is really good. The other question I've had from people is, do they get the medical completed by their physician, or do they get it completed by a specialist? And I would say whoever knows you best is the best person to complete it. You can add other information as well. The specialist will know specifically about an injury, which is great if that's the only reason that you have medical concerns. But if you have a general practitioner who you've been with for years, who know that maybe you have additional medical issues other than, say, a spinal cord injury. For instance, you can, if you've had issues with addictions, if you have mental health concerns, any of those kinds of things, any additional medical, diabetes, those kinds of things, those are all really important to put on your application. So that gives them a really full picture of, what you're looking at, how you're, you struggle with different things during the day, and just giving a round picture of what it kind of looks like for you. So I can keep going, but I don't know if I want to spend so much time on the AISH one. Let me just see. One other part that I want to mention about the application, there's a question on the application that asks you about your medical condition and how it impacts your ability to work. That one's a really hard question, I think, for people. I've had a lot of people come back to me and say, how do I answer this? Can I just say, look at my medical information from the doctor? But I actually learned from a wise person named Guy Coulombe on that question. Probably one of the best things I think you can do is write kind of a letter or a one-page kind of diary of what a typical day in your life looks like and how it would impact your ability to go to work. So there are things that happen during the day that would prevent you from being able to contribute to, work, put in a full work day. For instance, medication effects, sleeping, you might have to have rest breaks during the day, different, pain side effects, anything like that, because then it really puts a face to your application, and it's not just in a stack of other applications that they have to look at. So it's really helpful for them to get that idea of what a typical day in your life looks like and why you wouldn't be able to work full time. So, okay, I'll end there if there's any questions.
If there's no questions on that, and we can also take questions if they come up towards the end as well. But let's move on to the next.
Sure. So the Canada Pension Plan Disability kind of goes hand in hand with AISH. It's a federal program, same type of qualifying measures with the medical portion. You have to have a severe, permanent severe enough injury or disability that prevents you from working full time. The second part with the financial piece, it's not a low income program, but you would have had to make contributions to CPP for the last 6 years, or so that's one of the changes. I made a little mistake there. or 3 out of the last 6 years if you've contributed 25 years. So that was a little change that I kind of noticed on their website. So the benefit is not at all based on income or assets, which are really good. However, when you apply for CPPD, that money will be taken off of AISH if you're getting both. So when you receive your CPPD benefit, no matter what your age is, it doesn't affect the amount that you get for your CPP when you retire at 65. There's 2 levels of appeal: the request of a reconsideration of decision, which is, once again, the person who reviewed it the first time will look at additional new information that you send in. And the second is, if it's denied again, it would go to the Security Tribunal of Canada, which is a type of other panel. So one thing a lot of people don't know about CPPD is recipients have the option of participating in the Disability Vocational Rehab Program. We used to, like years ago when I did work for SCI Alberta, we actually used to manage some of this vocational counseling for CPPD. So if you're receiving the benefit and you're feeling, you know, like you might want to start returning back to work and kind of looking at what your options are, which is great. That's both CPPD and AISH want to see that. They want to help people be able to go back to work, even if it's a few hours a week, just to start reintegrating, getting that quality of life back when you're working, and just to, you know, start to get back into something you like. So with this vocational program, they'll offer stuff like vocational counseling, some vocational evaluation and testing, financial supports, and job search services. So that's really a bonus of the CPPD program. Now I did want to mention there's other additional funding that you can get in terms of course, there's the child benefit if you have dependent children. There is a child rearing provision benefit you can get if you were the primary caregiver of your children under 7 years old and younger. So you can get an additional benefit on top of the one you receive. And there is also a credit splitting option if you've been separated or divorced. The CPPD contributions that you and your spouse or common law partner made during the time you live together can be equally divided after the death, divorce, or separation. And just to note, there's a new part of CPP where like a lot of people find that when they turn 60, they apply for their CPP early, which does affect their benefit long-term. It will reduce the amount that you get for your regular pension. So you'll get a lower amount for, you know, when you turn 65. So if you find that you've applied for that and then you get to sustain a disability or an injury after that, say you applied when you were 60, you got it, and then you sustained an injury at 61, you can go back, reapply for the CPPD benefit, get on that instead of taking your CPP out, and then it wouldn't affect the amount that you would get when you're 65. Or if you find that within a certain amount of time you've applied for CPP, but then you would have qualified for CPPD, put in that application with the medical, and chances are you'll be able to switch to the CPPD benefits. So I guess that's enough for that slide. Okay, so the next one is just on employment insurance sickness benefit. This is probably relevant for people who have been working within the last year and have contributed or worked for at least 600 hours over the past year. This is a benefit that anyone can apply for. You have to meet the medical criteria, which really is just confirmation from your physician that you are unable to work because of a medical reason for however long. This benefit is up to 15 weeks. So, you know, preferably it would be more than 15 weeks that you would be accessing your employment insurance sickness benefit. There's a medical certificate that needs to be completed by the physician. You can apply online, and I believe you can go in. Right now with COVID, that's a little bit, I think they're not allowing people to come in yet. So right now it's just online or via an application. So once you submit the medical certificate, they will say sometimes EI that you don't actually have to submit it. You just have to apply and keep it on hand if they request it. However, what I've found in the past is when you do your application, mail it in, the original, because if they do request it, they will have it on your file and it will take less time. Sometimes there will be a time delay if you have to resend in or send in the medical certificate after the fact. So it can be upwards of 6 to 8 weeks before you receive your first benefit, because you'll get the approval usually about after 4 to 5 weeks, and then it will take a couple weeks for you to get it into your account. If you qualify, your benefit will be based on 55% of your earnings up to a maximum of $573 per week. So, and then you will get about 15 weeks of financial assistance. You have to access your employer's sick time and short-term disability before applying. And the other good thing about EI sickness benefit is you can do your EI sickness benefit if after the 15 weeks you're not able to go back to work, but maybe it's not medical, but you've been laid off or something like that, you can apply to receive regular EI benefits for the full amount of time. So I think that's around 52 weeks, up to 52 weeks. So you can get this on in addition to regular EI benefits. It doesn't impact your EI benefits at all. And it's the same way to qualify, 600 hours working the year prior. So I guess that's everything for the EI sickness benefits slide. Anybody having any questions or anything? Just feel free to.
So Karen, we do have a question.
Okay, great.
So the question is, do AISH and CPP look at each other's applications? If someone is applying for AISH and has already been denied from CPP, do you have to provide from CPP a denial letter to AISH, or can AISH access this information?
You do, when you do the AISH application, there is a part that you sign that allows them to look at anything from like Service Canada, CRA. So they could access it on their own, but my experience has been that you have to provide the denial letter from CPPD. So, and sometimes what will happen is when you apply for AISH, I've heard different stories around this, but AISH will sometimes submit your application you sent to them right into CPPD for you as an application, so you don't even have to apply. And then they'll, just on your behalf, so to speak, they'll send it in. So, but definitely worth talking to AISH about and finding out at that time what they're wanting, because they may want you to apply on your own. But yeah, they will oftentimes require the letter of denial.
There is also a question on the AISH application that asks you if you've applied for CPP as well. So just with what Karen said as well, I think that also gives them the idea if you have applied for CPP and have been denied. So they do ask you that on the application itself.
Yeah, and the good thing, so with AISH, you would begin your benefits from the time that they approve it, whereas Canada Pension Plan, you actually receive your benefits from the time you applied. So, you know, ideally get your application in as soon as you can for CPPD, because, you know, I've heard about people getting quite a large sum for back pay from their CPPD benefits. So, so then any more questions there?
Karen, maybe while we're on some of the federal programs, there was a recent announcement of a $600 one-time payment for the disabled community, and we've had a lot of questions on that. We've really the simplest answer, and this is really for our viewers, is that if you're currently receiving the federal tax disability credit, that you automatically qualify. So there shouldn't actually be any sort of application procedure. It really should be a $600 that appears in your account if you're already qualifying for the federal tax credit. So that might just be something that some of our community members listening in would have as a question. Have you heard anything differently on that one, Karen?
Just that, so yes, you're right. It's a $600 benefit. If you have your disability tax credit certificate, it's approved, then it's automatically a benefit you'll get. The other part is for seniors. It's a little bit less than $600 depending on it, because they'll be getting CPP and old age security. And I think that the federal government had given some additional benefits for seniors. So because of that, it's a little bit lower for seniors. People who are under 18 years of age can receive it, and it would go to your primary caregiver. So that's kind of what I've learned about that. It's happening. They say June 1st it happened, but I haven't really talked to anybody who started receiving it yet or received it. So the next slide is just about Alberta Barriers to Full Employment program. This program is really supposed to be kind of a bridge between, you know, someone gets injured, they can work, say, in 6 months or a year, but they don't necessarily qualify for AISH because they don't have a severe enough injury, and they will eventually go back to work, which is really good because that's, you know, generally I think it's good when people have that, you know, that focus on return to work. This program is a category of Alberta Works, providing a monthly benefit for lower income individuals who cannot work for more than 6 months due to a disability or injury. So that's 6 months plus 1 day. So more than 6 months. Lower income, I mean, it's quite low income. You have to show all your assets, your bank statements, your pay stubs. And I think you literally have to have less than $1,000 in your bank account to receive it. In most cases, it includes extended health benefits, prescriptions, dental, all that stuff. So that's really good. And on occasion, same thing with the personal benefits. If you have a special request, you can ask your worker. With Alberta Works, the difference between barriers to full employment and the regular return to employment program is that you'll have one case manager instead of having whichever person that you call who happens to be on the phone when you call, having that person deal with your file. So you have one person you deal with. You don't have to do quite as much reporting, and you'll get a little bit more money with the Barriers to Full Employment program. It certainly isn't as much as Alberta Work or AISH. It's probably, I don't even want to say because it varies, probably between $800 to $1,000 a month, which is, I know, very, very hard to live off of, but it is meant to be temporary. So medical note will be needed to show that your injury is long-standing. Ignore that part about permanency because I changed that one as well. But that it's longer standing than 6 months, and it needs to have a return to work date. The return back to work date is sometimes hard for physicians to kind of identify. So what I'll often say is put a date of reassessment down. So a date where they suggest they get reassessed by a medical practitioner again to see if things have changed. So the last thing with this is if you've applied and received this, if you've been on barriers to full employment for more than a year or two, you might want to start considering applying for AISH, because that's a good indicator that your disability is maybe more permanent than you thought it was, or it's going to be longer to recover or be able to get back into the workforce. So it's worth it to apply for AISH, because AISH and Alberta Works are both under the provincial government for programs, so they kind of, you know, work together to help that happen. So any questions around there? I can continue. So disability-related employment supports, DRES, funding is available to pay for supports that help Albertans overcome barriers to education or employment caused by disability. These supports help people with disabilities succeed in school and finding rewarding careers. To qualify, you must have a diagnosed or documented permanent disability, intend to work, and complete an employability assessment, which is done by DRES. So they just have to do a quick assessment of their own to make sure that you qualify. There's three areas that they offer supports in, which is job search, employment, and educational supports. And they vary. These are just some examples: adaptive equipment for workspace, assistive technology, assistance with note-taking, and allowing longer time to write exams. You also know that it really varies if you're rural versus urban, where you're living, because, you know, with somebody in a rural area, if you're going back to try to farm, it could mean, you know, things that help you with transportation, or could, you know, things like that. So it really varies depending on what kind of work it is and what your level of injury or disability is. So that's everything for that one. That's also a provincial program. So the RAMP program, Residential Access Modification Program, is a program that is also by the provincial government. They provide a benefit of up to $15,000 every 10 years for home adaptations related to access for people with disabilities. You can access up to $7,500 each year. I do want to add that when you apply, so if you were to apply for a bigger project, say you're leaving the hospital and it's for main access, so you're applying for you know, a ramp, widened doorways, you know, to get the rug out of there and get some better flooring in there. You can put that all into one application. You can only access $7,500 that year to go towards it. However, if you're applying for just a ramp today and in 6 months you realize that you need the, you know, widened doorways, then you're going to have to reapply and you're going to have to qualify financially again. And to qualify financially, this is just an example for an individual. Your income tax notice of assessment must show an income lower than $36,900. So it's not low income. I think for a couple, it's $46,000 around there. But it's certainly, you know, not for everybody. They do kind of base it on income. They also do consider if something has changed, your circumstances have changed and your income from last year doesn't reflect what you're actually making now. So if you can prove the last few months that you've, you know, stopped work, you can show them any pay stubs you have or your bank statement to show that your income is significantly reduced, they may make a consideration for you. You also need, there's two parts to the application. There's the part that you complete with drawings and like quotes from vendors, as well as a recommendation from a rehab professional, whether it's an OT, PT, physician, someone who's really familiar with your mobility needs. And you can be renting, own your home, or live with your family. So I think that's everything. Alberta Aids to Daily Living. A lot of people don't know that AADL is actually something that all of us have as Albertans if we pay into, or not pay into, but if we have Alberta Healthcare, it's kind of attached to that. And what it does is it provides 75% of coverage for approved equipment and supplies. So that is, they have a big listing on their website of what their approved equipment and supplies are. But not the upgrades. So if you're getting a wheelchair and you want special upgrades to it, they won't pay for that part. 25% is paid by the individual up to a maximum of $500 per year. So you'll never pay any more than $500 per year with the exception of upgrades. Now, the benefit year goes from July 1st to June 30th. Now with cost share exemption, a lot of people have kind of heard about this, where if you are lower income, and they base it on your previous year's notice of assessment from your taxes. For instance, your income would have had been less than $20,970. Then under the exemption, AADL would provide 100% coverage of approved equipment and supplies. So that's good for lower income people. If certain circumstances again have changed, same kind of thing where you may have lost your job or you may have come into the hospital, been in the hospital for months, you may qualify for temporary cost share exemption, which means that you would have that exemption for the remaining amount of time that the year that you're in, I guess. So if that makes sense. So yeah, so you certainly can apply for exemption if that's the situation. Next. Disability tax credit. CRA recognizes that people who have disabilities and medical conditions have a higher cost of living due to expenses related to their disability. So that's when they developed or put in the disability tax credit. To qualify, a medical practitioner has to fill out the disability tax credit certificate, certifying that you have a severe and prolonged impairment, and part of it is just describing what its effects are and for how long you'll have that disability. If the date is, say, a year or two that they can put, they don't put that it's long like a permanent disability that's going to impact you kind of for foreseeable future, then you'd have to get another disability tax credit certificate done when that one kind of expired. So sometimes doctors are willing to say it's prolonged. Other doctors want to say a year or two and then get it redone. If you qualify for the disability tax credit, it also will lower your income level, which may help you qualify for other low-income programs. And there are other benefits to the disability tax credit. There is a resource that we're going to hopefully attach called the Disability Related Tax Information Booklet that shows you like how you can expense medical supplies. There's the home accessibility tax credit people usually don't know about that help. I think you can claim 10% out of $10,000 towards home renovations. It's not very much, but every little bit helps. So I encourage you to read that booklet. And then as we described, the one-time benefit for related to COVID. So.
Karen, we have a question from the audience, and this one comes from Beto. So a lot of people are probably familiar with Dr. Loyola Sanchez, and he was curious about our interpretation on the effectiveness of return to work programs in the province after a disability. So I have some thoughts on that, but first I thought I'd toss that one out to you and see how you feel that is currently working and how effective it is and what programs are available.
So with return to work, it's really, it's kind of a hard thing to pinpoint because oftentimes programs won't be referring to your past employment or where your past experience lies. They will most often look to see, are you able to do any job and kind of anywhere, like, you know, full-time or enough to make a living. So that's kind of how they assess returning to work. So yeah, and the other part of it is, can they do a job with adaptations or modifications to the workplace, working with the employer to provide, you know, some changes maybe to the job or modified work, things like that. So yeah, and then return to work in terms of, I think one thing that I've heard, especially from physicians, is that it's really hard to determine what it would look like for return to work, like that actual date. Like a lot of people just don't want to put on that actual date to determine when a person will have to work again, because nobody can know that. It's in the foreseeable future and we just don't know what's going to happen. So oftentimes when we'll look at AISH, for instance, and they'll talk about, you know, will you ever be able to work or in the foreseeable future? We look at the target of about 2 years. What are things going to be looking like in 2 years? You know, and once again, doctors can put reassessment instead of an actual return back to work date. But yeah, it's really challenging because that return to work, it's a catch-22 because we love it when people return back to work because there's so much a part of that quality of living and that contribution that you get from working. But still, if you're entitled and eligible for these programs because you just cannot work, then it's important that we help you get there. So I don't know if that answered some of it, but.
Well, we'll see if Beto can maybe, you know, respond if he has another follow-up question. My feeling after having listened to a lot of components where government is asking questions and I ask them questions and other community organizations do, certainly it seems like there is an appetite in the recent AISH changes that they've had. There was a recent document that was updated. They are implementing, the province is implementing a little bit more of a reassessment of AISH after a certain number of years, which wasn't there if you go back 10 or 15 or 20 years. So there wasn't as much reassessment about people being on AISH, but it looks like the government is going to pursue that a little bit more. And my guess is, this isn't for sure by any means, but my guess is that if the government takes that approach, that they're also going to try and implement more vocational rehabilitation and actually try to create a situation where people may be on AISH, but they might be able to graduate into a more of a gradual return to work program potentially. This is me just a little bit of educated guessing, but I feel that this is the direction that the UCP is going to try and take it. So any community member that's listening to this, you know, ask questions. SCI Alberta is definitely there to help. Karen's there to help, you know, all of the members in the community to try and answer questions. But I think that there will be some changes in some of the provincial funding programs in the next few years. I think that the UCP definitely are going to make some of those things in order to try and reduce expenses. So we'll see how that goes. Alrighty, the next, let's see. What slide are we on for you here, Karen?
We're almost done, I promise.
There we go. We'll go to the next
ones. So this one I'm not going to spend very much time on. Just let people know that, like, usually if you're aware of these or on these already, like, or the people who qualify for these are already on them. They don't really need a lot of information, but just generally WCB, short-term, long-term disability, and private insurance. They're related to employment benefits and work-related accidents and injuries. Individuals and their employers, they pay a premium each month prior to injury to qualify. In most cases, they will provide a monthly income replacement benefit as well as extended health benefits, and in some instances, supplies, equipment, home adaptations. I've seen. I do want to put it out there that people become very, very aware and review their policy related to their insurance. Because there are intricacies, there's things in there that you never would have thought they'd cover. I've had people receive a daily benefit for being in hospital. I've received some people who have been able to pay for some home adaptations, any equipment like a bed or a second wheelchair sometimes. So really become familiar with your policies, and sometimes it can be a little bit hard to work with. You have to pay up front, get reimbursed. Always get a pre-approval for things if you can. But yeah, so that's just another form of funding that people can access. And the last slide is just about, I just want to throw it out there about Alberta Supports. So there's Alberta Support Centers all across Alberta. They focus mainly on offering assistance and information about all of their provincial programs. So back when I was talking about some of the other ones, AISH and AAGL, Alberta Works, those kinds of programs, they kind of house all of them. So it's a one-stop shopping kind of an idea. They have services, information for all types of people in different circumstances or situations. Yeah, you can generally go in, with the exception of COVID right now. They aren't really allowing that, but they do have a toll-free number that you can call, pretty much during the day, I believe it is. There is an emergency line you can also access, but that you can call for assistance. They'll direct you where to go, or they can help you apply for things. So that's a good resource just to have on hand. And I think that's about all of my information, and I took way too much time, I'm sorry.
No problem. Thank you, Karen. I'm going to stop sharing the screen there. And thank you for all that information, Karen. And I'm going to turn it over to Zara, our program and leader in Southern Alberta for Calgary.
Hi, everybody. Karen, that was an amazing presentation. Thank you. So I'm going to be talking just a little bit about how SCI Alberta works with both the Glenrose and the Foothills Medical Center, and how you're able to contact us while you're up at the hospital or even after discharge. So I'm just going to share my screen here. Can you guys see that?
No, not yet, Zara.
Okay, 1 second. How's that?
There we go. Yep.
Awesome. So throughout the province, we do have client service coordinators, and our client service coordinators typically visit you up at the hospital about 2 weeks prior to discharge, and we provide support to people with spinal cord injuries and other physical disabilities throughout life to transition effectively into the community after injury. And sorry, I'm just trying to get to my next slide here. So our client service coordinators provide assistance with advocating for supports necessary to live in community of choice. So for example, if you go back home and then say 6 months down the road, you decide that the place you're living at is no longer accessible to you, or if you're just looking at moving into a place where there's no ramp if it's needed, SCI Alberta can support you in filling out the application. You know, we can even come out, take pictures, and send them off directly to ramp for you. So that's just an example. We also provide support with financial support. So, you know, when you get discharged, you may not need to go on AISH right away, or you're on short-term disability. And SCI Alberta can actually support you with even filling out an application and sending it in to AISH for you, or just simply filling out the application itself. We also support with finding accessible housing. So if you are thinking of moving once you are discharged, we can support you with that. Same thing with accessible transportation. If you are needing accessible parking, we can support you in filling out an application. And accessing home care, managed care. Self-managed care is a really big one. You know, there have been times where, you know, you may not get enough hours, and, you know, if you're looking at getting someone to advocate for you, we can, you know, discuss this with your caseworker and support you in that aspect. So outpatient clinics, so both with the Glenrose and the Foothills Medical Center, we do visit patients 3 months with their 3-month follow-up post-discharge with the designated physiatrist or nurse practitioner, which is really nice because it gives you the opportunity to meet our client service coordinators right in clinic, and there may be you know, things that were in the works while you're at the hospital that maybe didn't get completed, or you're appealing AISH, or you need more information. So we can actually advocate and support you with that. It also gives you, again, an opportunity to meet Spinal Cord Injury Alberta. And we support with referrals as well. So if you are looking at, you know, looking for funding, or, you know, even for like funding that, or you didn't get enough funding from, say, AADL, or if you're looking at funding to go towards like equipment that is needed and you just don't have the funds for it, we can support you in trying to find or locate funding. And we also offer psychosocial support. So, you know, if you're looking at getting some counseling services, we can support you in that as well. And I just wanted to touch base a little bit on our CAPSI program. CAPSI is Community Access for People in Continuing Care. And this is funded through the provincial government to provide community interaction for people between the ages of 18 and 65 living in long-term care. Our program services about 350 plus clients with about 59 facilities throughout the province. And how this program works is our community access coordinators will go into an intake with the person who is interested in becoming a part of our community access program. And our community access coordinators find appropriate companions that fit the needs of the client that's living in long-term care. And the nice thing is it's a no-cost program for our clients. It's directly paid from the provincial government. And we've had this program for probably about 11 years. And it's a really great program because it provides, you know, inclusion in the community and gets clients living in long-term care out into the community doing programs that they like, such as, you know, swimming or going to the movies, etc. And that's what I have as a snapshot of what SCI Alberta does. I'd like to thank both the Glenrose and the Foothills Medical Center. It's really great having a relationship with them because, you know, when patients get discharged, we want you to know that we're here to support you. And thank you to all the participants as well that joined the call today. There will be a resource guide sent out to you with all of the provincial and federal programs available, as well as a few organizations that also support people with disabilities. And I am willing to take any questions. I hear no questions.
Thank you, Zara. Great presentation. Much appreciated. So just to kind of wrap things up here, let me make sure that I have all my information. We've got, every 2 weeks now, we are going to be consistently pulling these presentations together, all with different topics each time. There may be some topics that we redo if they're particularly popular. We hope that a few of you, hope that many of you were able to complete some of the polls. We'll be asking our friends at Praxis, Joanna and Charlene, to help us with that, probably on several meetings coming up, because we really do want to hear from our community members. When is a good time to meet? What are the topics that you're looking for? These webinars are here for you and to be as informative as possible. So on that, let me make, oh, there we go. So now I just have the poll that actually came up in front of us. So what you'll see is your preferred availability to join future webinars. So we're looking for the best time here. So Mondays, Wednesdays, or Fridays at noon. This is important for us to know because we want to have as large a participation audience as possible. So please participate. Please do let us know what your preference is. And we will definitely be taking it into consideration as we do this. This isn't something that we're just going to do during COVID. This is pretty much what we're planning is sustainable, and for the next number of years going forward to have webinars every 2 weeks with community input. I want to make sure that I pull up a slide so that everyone can kind of have a sense of where to find us. And also to thank, oh, how good is my PowerPoint skills here. So first, thank you so much for everyone that helped put together this webinar. The pictures that are not there are of Joanna and Charlene in Praxis, who helped make all of this possible as well. Thank you, Karen, Zora. And this is where you can find us. So our social media is now a little bit more active than it has been before. And if you have additional questions about the webinars or anything in general, especially peer related, please direct them to Steve Crochetier at sci-alberta.ca. Steve is our peer coordinator extraordinaire, and he loves getting questions. So on that, I would like to say thank you, everyone, for attending. We're going to be back here in 2 weeks' time with another topic, so look on social media for any sort of updates on that. So until we hear sort of the news about other times.
Just a quick, oh, sorry, just a quick note about, we did put together like a resource handout, and I think were we gonna see if people wanted to send their emails to get it? Is that how we could send it out to people if they're interested?
Yeah, I believe that when people register and when they get into this webinar, they typically provide their email address. So everyone that's an attendee will be able to get that handout for sure. But great question, Karen. So if there are no other questions, I will hop out of this, look to see, I'll have a couple of, we will follow up as well if there's any questions in chat that we missed. But if there are no other follow-up questions, thank you so much for joining. Thank you to all our presenters. Thank you everyone in the community for attending. And we hope to see you again in a couple of weeks.